Good evening, everyone. On the behalf of Group 6, I would like to welcome you all to our presentation on telehealth in chronic disease management. Okay, let me begin by introducing our team members. Mm, okay, Abhishek, it's myself, then Andrea Singson, Atoy Abimola, Menka, Rakib Nazir, Sandeep Kaur, and Twinkle.
Hi, I'm Andrea Singson. I am tasked to discuss the definition of telehealth and its evolution. Telehealth is an information and communication technology that allows for health services to be delivered over a distance using electronic or telecommunication devices. The benefit of using telehealth technology is that the healthcare is accessible to all persons no matter where they reside. For example, the client access the service in their community instead of traveling to see a specialist in a larger community. Now, we will talk about the evolution of telehealth. The evolution of telehealth has been driven by both technological advancements and the growing need for more accessible, efficient healthcare. In the early years, telehealth was primarily about telephone-based consultations, followed by the integration of fax and email systems for transmitting health data. As internet technology improved, telehealth evolved into more interactive forms, such as video consultations, real-time monitoring, and remote diagnostic tools, which have made it a central component of modern healthcare delivery. How telehealth supports quality patient care. First, improve access to healthcare, reduces geographic barriers, especially for rural and underserved populations, enables access to specialists without long travel times. Second, continuity of care. Remote monitoring enables ongoing care for chronic conditions. Virtual follow-up ensures patients stay on track with treatment plans. Third, enhance patient outcomes, reduce hospital readmission rates, improve chronic disease control and early interventions. Fourth, cost effectiveness, reduces travel and unnecessary hospital visits, prevents costly hospitalization with early intervention. Fifth, convenience and flexibility, allows patients to consult from home, flexible schedules for healthcare providers, reducing burnout.
Good morning. My name is Atoya Bimbola Oluwaseyi, and I will be talking about the impact of telehealth on health workers. Firstly, telehealth can also be known as telemedicine and is the use of digital technology to deliver healthcare services. The impact of telehealth on healthcare workers. Telehealth improves efficiency such as scheduling of appointments and it saves time. Telehealth facilitates collaboration between healthcare workers by fostering excellent communication and fostering teamwork. Lastly, telehealth helps to reduce healthcare providers' burnout and it brings about satisfaction. Thank you. Moving on. Now, I'll talk about patient-centered health and telehealth. Telehealth aligns with patient-centered care by prioritizing convenience, accessibility, and individualized care. Secondly, telehealth improves health literacy because the patient have access to their informations. It improves health literacy, and by so doing, it helps them to continue their care even after being discharged from the hospital. It enables them to know what to do. And lastly, it brings about personalized care. Patients can schedule appointments that fit into their schedule, and by so doing, it will bring satisfaction to them. Thank you.
As we discuss about the telehealth, so with the benefits of telehealth, there are some challenges or barriers that we face. So first of all, like technology barrier, like in some areas there is limited access to technology. Like many individuals, especially in rural areas and low income areas, there is lack lack of necessary devices or reliable internet connections, which creates a significant barrier to telehealth services. Also, there is digital literacy. Not all the patients or healthcare providers are familiar with using telehealth platforms, apps, or devices, which leads to frustration and limited effectiveness. Reliability of equipment. Telehealth depends on functioning hardware like cameras, microphones, and devices. Technical glitches or outdated equipment can disrupt communication and care delivery. Second is privacy and security. Data security risks, confidentiality in home environments. Like in home environments during telehealth sessions can be challenging, especially in shared living spaces, like which may like some patient may be hesitant to discuss sensitive health concerns. Quality, third one is quality of care. Like during telehealth, there is limited physical examination. There may be overuse or misuse of telehealth, like can sometimes replace essential in-person visits and potentially compromising the overall care quality. Health literacy challenges also there, like some patients may struggle with this to communicate effectively or follow instructions in a virtual setting that can impact outcomes. For last one is legal and ethical challenges like informed consent. Like patient need to fully understand the scope and limitations of telehealth services, which can be like unclear during virtual consultations. Professional boundaries, like there may be blurred lines between professional and personal interactions that can pose ethical dilemmas. There is also accountability and liability. So it can lead to adverse outcome that like it involves multiple providers and systems, so it can lead to accountability and it can intervene an outcome.
Hello everyone, I am Abhishek. I will be discussing the roles, importance of telehealth in managing chronic diseases. The focus will be on how digital technologies are transforming healthcare delivery and the key benefits healthcare offers in these domains. So, overview of telehealth in chronic disease management. What is the telehealth? Telehealth uses digital technology for remote healthcare delivery. This can include consultation, monitoring, delivery care without the need for physical visits to a healthcare facility. It has become a vital tool in improving access to healthcare, especially for chronic diseases patients. So we have primary benefits. First one is improved access. Reaches patient in remote or underdeserved locations. Telehealth significantly improves access to healthcare, especially for patients in remote or underdeserved areas. It ensures that distance or lack of resources in certain regions does not prevent individuals from getting the care they need. Second one, real-time monitoring. Track health metrics and enables timely interventions. Telehealth allows for real-time monitoring of health metrics such as blood pressures, glucose levels, and more. This capability enables timely interventions of patient, potentially preventing the complications or emergencies they have. Third one is patient empowerment. Encourages patient to actively manage their health. This includes telehealth empowerment. Okay, so next we have importance of telehealth in chronic disease management. First one is reduce hospitalization. Telehealth helps reduces hospitalization by enabling early detection and management of conditions, which lowers emergency visits and hospital admissions. Next one, cost savings. Cuts healthcare costs by minimizing in-person visits and resource uses. Then continuity of care. Telehealth ensures consistent follow-up, making it easier to manage long-term conditions effectively over the time. Then personalized care plans. Using data-driven insights, telehealth allows for the creation of personalized treatments tailored to the specific needs of each patient. Then, better patient outcomes. Proactive monitoring and guidance improve health outcomes and quality of life office. Then, enhanced collaboration. Lastly, the telehealth facilitates better collaboration among healthcare providers by enabling seamless information.
Now I'm going to present about application to nursing practice in telehealth. First one is remote monitoring. The monitoring of vital signs and management of chronic conditions. Second one is virtual consultation. It means provide follow-up and evaluation. Third one is health education to provide knowledge about disease management and lifestyles. Fourth one is care coordination to enhance communication within the teams at all levels of healthcare. Post discharge care. This includes recuperative aid and readmission avoidance. Mental health support. It means giving counseling and therapy through virtual sessions. Health screenings, preliminary checkups followed by referral for further care. Thank you.
Hello everyone, I'm going to present the future of telehealth in nursing practices. Firstly, it will help in integration into routine care. Telehealth is becoming a standard part of healthcare delivery, which is advanced technology and increased acceptance during the COVID-19 pandemic. Telehealth allows nurses to provide care remotely, including consultations, follow-ups, and patient education. Next, it will help to expanded access to care. Telehealth improves access for underserved and rural communities. Nurses can reach patients in remote areas who may lack access to healthcare facilities, reducing health disparities. Telehealth bridges the gap for patients who face barriers such as transportation or mobility issues. Next, it will also helpful for chronic disease management. Telehealth supports continuous monitoring and management of chronic conditions. Next, it is also a cost effective. Telehealth reduce healthcare costs by minimizing the need of physical visits and hospital stays. Telehealth can lower expenses for both healthcare system and patients. Nurses can triage and provide timely care without any delays. And next, advancements in technology, emerging technologies will shape telehealth's future, which means artificial intelligence, machine learning, and advanced data analytics, which enhances nursing decision making, while augmented realities may be used for training or virtual assessments. Next is evolving roles for nurses. Telehealth is redefining nursing roles. Nurses are taking on roles as telehealth coordinators, patients educator, and technology trainers. The evaluation requires advanced training in digital tools and communication skills. Lastly, global collaboration. Telehealth fosters the international collaboration in healthcare.
Hi, my name is Rakib Nazir. I'm going to continue with the ethical considerations regarding telehealth. The first one is informed consent. As we know, it is the permission taken from the patients before proceeding in any ways, like in telehealth, before proceeding to the information and the disease condition and all those. So before doing all this, we take a permission from a patient. That's called informed consent, and in which all the policies are written and that are electronically signed by the patients. The second one is patient's privacy and confidentiality. After providing all those information, the resident wants privacy and confidentiality, and that's ensured by the healthcare team such that it's secure, it is secured for all, such that everybody can have the right to confidentiality and privacy. So the third one is equity and access. So it should be accessible to all to use the technology and getting benefits from everywhere or anywhere else in the world. So then after that, it is professional limitation. So there should be the limits or boundaries between the healthcare providers and the patients, such that there is no mixture and such that there is no sharing of any other information that is useless. That can impact the care of the patient. And after that, it is second one is autonomy of patients. So it is a right of every person to have a dignity or respect. So patients choices are respected and dignity is provided to them, which enables us to foster the positive care and enables us to make a connection, positive connection between the healthcare workers and the patients, which helps them to getting better patient outcomes. And the last one is sensitivity to culture. As we all are in Toronto, Canada, so we know like it's diverse nation, so we people from all over the globe are present here. So we have to keep in mind that every culture has its own perspective. So before taking care of any patient, we should take care of her cultural sensitivity. So we should be culturally sensitive and competent. Thank you so much.